Yeah. Okay. Great. So Mindy, we're on slide one. We're on acknowledge. If I can move it forward, give me a second. We're at the acknowledgement.
Great. All right. Well, welcome everyone. We're delighted to have you. Before we begin, I'd like to acknowledge that the Kootenay Boundary Patient Advisory Committee and Community operates within the ancestral, traditional, and unceded territories of the Ktunaxa, the Syilx, the Sinixt, and the Secwepemc nations. We respect and honor all our nations. So my name, next slide. My name is Mindy Smith. I am a clinically retired family physician and teacher and researcher. I'm also the founding member of our patient advisory committee and am currently a member. Paul Edney is also with us. Wave, Paul. And Paul is from the Kootenay Boundary Divisions of Family Practice and our communications lead. And then Kim is also with us, and she can wave, and she's also from the Kootenay Boundary Divisions and our main support person. Next slide. So today I'm going to be telling you a little bit about the Kootenay Boundary Patient Advisory Committee and Community, affectionately called our PACC. We're going to be reviewing our new surgical pathway. This is a guide that includes 6 steps that hopefully will bring a better surgical experience, and also is a resource guide and not medical advice. So we have lots of links and lots of suggestions and ways of helping you navigate. But if you have medical questions, those should be raised with your various clinicians or the 811 line. We'll also go over some next steps for our advisory committee so that you can see what we're up to for the coming year. There will be plenty of time for questions along the way or at the end. And as Paul mentioned, at the bottom of your screen, there's a bar for Q&A, and you can put your questions there. And Paul and Kim will be monitoring that so we can stop as we go along if you have questions. Next slide. One more. There you go. Thank you. So our Patient Advisory Committee and Community, or PACC, is a working group of the Kootenay Boundary Collaborative Services Committee, or CSC. That committee is a forum where family physicians, as well as the Health Authority and members of the SPSC, which is the Practice Services Committee, work together to address issues and develop solutions related to health and healthcare delivery. Our PACC was formed in 2018, and it is a working group. We developed this working group because we really felt that it was important to have more patients involved in offering advice and our concerns to people in positions of authority in the healthcare system. We are supported by the Divisions of Family Practice and Interior Health. Our initial task was to engage with these healthcare leaders and researchers to bring that patient perspective to healthcare decisions. So the PACC's purpose is to be a leader in patient engagement, to increase diverse patient voices and participation in decisions made about our healthcare, and to educate and empower patients to become more health literate and also hopefully healthier. Next slide. So PACC operates under the following values. We are patient-centered. We try to be representative of our various communities. We look toward being equitable, collaborative, empowering, and respectful. Next slide. Our initial work was to provide comments on topics and review patient-facing documents and surveys. We also served as a focus group for the University of British Columbia group who are interested in patient records. We are linked with the Selkirk College, their rural pre-med program, and work along with the third-year students on their community engagement projects. And we spent a lot of time in the beginning developing a strategic plan, our website, and an engagement form. That engagement form we use when people come to us with questions from the healthcare system so that they can organize their thoughts around what they're asking us for, and also close the loop with us so that we know how our information was being used. Part of our strategic plan, though, was to move from being more passive, where we waited for others to come to us for advice or input, to a more active role in public education. And that brings us to the next slide. Our first independent project was called Empowering the Citizen Patient. Next slide. This was a campaign that began in 2023, and you can link into all of those articles on our KBPACC website, kbpacc.ca. Our group created 12 articles. I wrote the initial content, and then we had a small working group who actually wrote the article along with our communications lead, Paul Edney. The articles were all vetted by topic experts. They all went to all of our PACC board members to get their perspectives and some quotes, some content from their experiences with the topic. And then the Collaborative Services Committee co-chairs, we are very fortunate to have 3 co-chairs who represent the divisions of family practice, interior health, and First Nations. And all of them went through the articles to let us know if we were meeting the needs of patients in our region. The articles appeared monthly in local newspapers and on social media, in addition to PACC's website. The 12 articles are shown on the next slide. So they ranged from how to navigate care through our system, introducing all the different aspects of our system. They included information on medications, caregiving, all the way down to patients who do not have a primary care clinician and need care, what resources are available for them, how to track your health conditions, and how to support our healthcare system. Next slide. So this is an example of our QR code that will allow patients to access our articles. You can also, again, go to the website from your computers.
Yeah, Kim has just dropped that link into the chat. So if you see on the navigation at the bottom, there should be a little couple of chat symbol. If you click on that and it has the word chat underneath, you'll be able to see the link, and you can actually click on that link to go directly to the articles. Or with the QR code here, you can scan it if you've got your phone with you. All right.
Thanks, Paul.
You
Next
bet.
slide. So this is really the meat of our presentation today. Patient Pathways was a project that began this past year to create comprehensive step-by-step guides that hopefully will support patients in meeting their healthcare needs. The primary goal of today's presentation is to review our patient pathway for surgery. We're also going to be talking a little bit about our peer-to-peer online community forum. Next slide. So our community guide, which looks a little like this, is Navigating Your Surgery and Recovery. It's available as a download from our website, also available in print at many locations, including our local libraries and a number of the clinics. I'm going to be walking you through the content of that brochure, and the following slides are providing categories in each step that are expanded within the guides. So the guides include all kinds of links and information, questions to consider. So what I'm giving you is really an expanded outline of what you'll find in our 15-page guide. Next slide.
And just to say again, Kim has put a link directly to the page on our website, which contains a link to the brochure. You can download it from there. And as Mindy was saying, it's available in clinics. It's available in community across the boundary. And you can always email us if there's if you'd like a printed copy. Again, our link to contact us is on the website as well. KBPACC.ca website. Next slide.
Thank you. All right. So the first step that we address in our guide is when you first find out that you have a need for surgery. The guide attempts to walk you through the referral process and helps you consider whether or not you have a preference for a surgeon or whether you're willing to take the first available and which location. So that way you can see whether you're willing to wait a little bit longer to get the preferred surgeon that you have in mind, or you're willing to take first available. We also want to ensure that you know the correct information and what the timing might be. So coming up to surgery can take anywhere from a few months, depending on the urgency, all the way up to several years. Additional testing is,
Can I ask you a quick
yes.
question? I'm actually, it wasn't a question that
That-
came in, but it just came into my mind, Mindy, and I'd love to get your perspective on it. And I think that there's some people may not know that you can choose the surgeon. Like you can do your own research and find a surgeon that, you would particularly like to be with. Is that correct?
That is correct. You can ask for a referral to a specific person, but you can also, if you don't have a specific person in mind, ask for the first available. And that will likely get you in a little more quickly.
Got it. Thanks.
There are also, sure, you bet. There also may be a need for additional testing. And one of the tricks here is if there is additional testing that's being done, please try to get copies of those reports. So if they're done through, for instance, through the Trail Hospital, those reports will appear on the Interior Health website. That is your patient portal, My Health portal. And that way you can download the actual report. But it's really helpful if you keep track of the results of your tests so that you can take them with you to your specialist, because they don't always have that information, and it avoids needing additional testing. Sometimes care changes are needed. So there may be new medications or treatments, such as physical therapy. And you also want to be aware of what monitoring you might need to do for ongoing problems, and when you might trigger an additional visit with your provider because your symptoms have worsened. It's also a wonderful time to think about taking steps to improve your health. For example, if you're a smoker, this would be an excellent time to quit. And our guide includes smoking cessation resources. Next slide. So step 2 in the process is preparing for your specialist visit. One of the most important things, as I mentioned, is to bring the information that's needed with you. So if you have test results, if you have questions, bring them with you to that meeting. The guide helps walk you through some questions that may be helpful to ask your specialist, such as the seriousness of your health condition, what complications might be expected from your particular surgical procedure, what are alternatives to surgery that you might be considering, or alternative procedures. You can request information, and we suggest that you request that information in writing if possible, and along with any changes that might be needed in your medication management. There are also trusted websites that specialist may direct you to, where you can get further information about your surgical problem or surgical procedure. And for those of you who actually like to watch procedures, YouTube is a great source that will have almost every procedure known. So if you have a knee replacement, they'll actually walk you through what that procedure looks like if you're interested. You want to make sure before you leave that specialist visit that you have all the contact information for them that you need, and know about any restrictions that you may need prior to your surgery. For example, dental care is sometimes needed, but it might delay your ability to go for surgery. So you want to know if there are any restrictions on your other health care that may preclude going to surgery quickly. Next slide. Part of step 2 is also recovery planning. So start to think about whether or not you need a work leave and what the time frame might be. So for those of you who are, as I am, over that 60-65 mark, it's often helpful to extend that time beyond what they recommend, because it takes us older folks a little longer to heal. You may also need family or home support. And it's a good idea to begin talking with those support people ahead of time so that they're prepared to give you the assistance that you may need. You also might have equipment needs. And there are many ways of getting that equipment, whether they're wheelchairs or shower chairs. Equipment can be rented or borrowed. So there are sources such as Kootenay Home Medical, local pharmacies, the Red Cross, and those resources are highlighted in the guide. You also should think about whether or not you need a consultation with someone so that you can better prepare for surgery. And that someone might be an occupational therapist or physical therapist who can help you sort of think about what your recovery would look like and what equipment or additional assistance you might need.
Mindy, can I
Next
ask you
slide.
quickly on
Sure
that
can.
on yeah
Hmm.
on that front, we had when we interviewed some patients initially that there is some support with some clinics and with some within the community. Is it home health that also you can get support in this and consultations? Is that correct?
Yeah, absolutely.
Great, thanks. And that information's in the
Right.
guide as well.
Yes, and we've tried to be as comprehensive as we can for what those resources are in the guide. But as you'll talk about later in our community forum, there may be things that we missed. And so this is a way for patients to help each other as they navigate that process. And we'll get to that at the end. Thank you. Next slide. So step 3 are the preoperative visits. So one of the key people who will be guiding you through that is the surgical scheduler. And we have links to all of those people in the guide. The first real visit is usually with the anesthesiologist. An anesthesiologist is the person who's going to be monitoring you during your surgery and often manages your pain control. So be sure that they have a record that they can pass on about your preferences, because the person who interviews you and talks to you isn't necessarily the person who's going to be attending you during your surgery. So you want to be sure that if you have preferences for medications, for example, for pain, that information goes into the record that someone will be able to access when you actually get into surgery. The anesthesiologist will be reviewing your medical history and have a plan with you and we help walk you through what questions you might want to ask them about and whether or not there are special instructions for your particular condition or case. If you have pain management preferences, if there are things that don't work well with you, this is the person that you should discuss them with. There also might be a benefit to a recovery specialist, and that can include a respiratory therapist, a physical therapist, or occupational therapist. And sometimes meeting again with those people before surgery will help you be better prepared. There may be equipment and home support needs, as I mentioned. One of the great links, the resources that we link to in our guide is Fetch. So Fetch is a community resource that provides links that are very easy to access throughout communities in the Kootenay boundary. So an excellent resource to consider accessing. Finally, next slide, part of phase 3 is the waiting period. So this can be really difficult for people because between the specialist deciding that you're going to need surgery and actually getting that procedure can be many, many months. While you're waiting, there are a few things that you can do that will help to pass that time productively. One is to focus on your own wellness. So are there things you can do to build your stamina? And those, we have links to HealthLink BC, which is an excellent resource that helps you find things about exercise and diet that might be very helpful to engage in at this time. Also, again, build that support network. There are support groups for many, many of the different surgeries and conditions that people have. And again, we provide links to some of those groups, but there are websites specific to conditions, for example, cancer or heart disease. And they are a wealth of information. And also, most of them have support groups that you might decide to join, and they can be very helpful during this waiting period. Finally, if you find that you're feeling very stressed or anxious about an upcoming surgery, we have links in the guide to mindfulness training, to yoga, meditation, and you may also want to seek counseling or discuss medications with your healthcare provider. Next slide. So step 4 are where you're really beginning to actively make plans for your surgery. And that includes things like travel plans. And again, we tried to include as many links as we could think of to where you might contact assistance with travel. So there's transportation assistance through the Cancer Travel and Accommodation Services, volunteer drivers that are available in your local area, Hope Air, BC Travel Assistance. So there are many resources that are available. You don't have to always do this on your own. In addition, when you're thinking about your lodging, if you're going to be staying at the hotel after your procedure, think about getting a handicap room. So those rooms have showers that are accessible and supports that you may need. And there are wide doorways, those kinds of things if you're going to be in a wheelchair. So think about that ahead of time so that you can plan for your travel. In terms of work leave, many of you have insurance or sickness benefits. So this is a good time to know what those are and how you can access them. Preparation and arrival is usually handled through the scheduler, and they will be giving you specific instructions about where to come to at the hospital, and they may call you right before your surgery to get an update if it's been a while since they've spoken with you. Things to bring include your BC card and certainly any arrangements for a hotel stay. Sometimes it's best to go home right after the procedure because pain onset may not be in the first 12 to 24 hours, but might be the next day. And so waiting another day to come back home might actually create more pain if you're traveling a ways in the car. So again, think about those kinds of things and go over those with your surgeon and surgical scheduler. It's great also to have supplies ready at home. So if you know that you're going to have a wound that you need to take care of, if you have specific medical needs, having those supplies already at your home will save you a step and a lot of worry. Next slide. Step 5 goes over what is going to be going on the day of surgery. So the instructions, again, will be coming usually from that surgical scheduler. But be prepared for delay and possibly for cancellation. One thing to know if you are canceled is you will be rescheduled within a short time period. So it's not like you're bumped back into the back of the line. So that usually happens within a week or two if you end up getting bumped. And the reason is because someone with an urgent need required that surgery. So it's not done willy-nilly, but it is very frustrating when it happens. Before you head, if you're going out of community for your surgery, for example, I went from Trail to Kelowna, be sure to check your phone for messages because I found out my procedure was canceled by a phone message when I got to Trail, and it prevented me from having to drive all the way to Kelowna and find out that my procedure was canceled. So be sure to watch for any phone messages. Also be aware of any restrictions. For example, can you eat? So if your procedure is in the afternoon, you might be able to eat, you might be able to take liquids, but you should know that and be prepared. Also, do you need to take your medications? So these are things that we help try to walk you through with the guide, but that will help you be better prepared for when you get to surgery. In terms of what to bring, pack light. Don't take anything that's unnecessary, but I do advise, for instance, don't take valuables, but I do advise that you take something to do. So again, surgery doesn't always happen at the hour that they say it will. So a paperback book, something that you can occupy yourself with as you're waiting. Also, any essential equipment like your eyeglasses, or if you're someone with obstructive sleep apnea, you might want to bring your CPAP machine because they don't always have those available, and it will make your stay, if you're staying overnight, far more comfortable and safe. The surgical scheduler will be telling you where to go, but also ask them about where your support person should go. A support person is really helpful, particularly early in recovery, because they're the people who can actually help you remember the instructions, help you ask questions that you have, and take notes. For example, after my surgical procedure, I actually have no memory of the recovery room or the drive to the hotel or talking to my family. I really don't remember anything until later that evening. So having that support person there to tell you, yes, in fact, we did drive to the hotel and you did have dinner, is very helpful. Next slide. So step 6 goes over post-operative care considerations. If you are sent home the same day, you should have some written instructions. If you're overnight, there will usually be a discharge summary. If possible, see if you can get a copy of that summary. It will be sent to your healthcare provider, but not all of us have that person. And it's always good to have a copy just in case. For wound care, if you're staying overnight, there are often supplies in your room that you can take with you. So that will help save on a little bit of cost. But be sure to either purchase the supplies on the way home or have them at home already so that you don't have to run around when you're not feeling very well and you just as soon get home and get into bed. You also should have a list of signs and symptoms that you should monitor so you know when to come back for help. And any new medications, you might want to make sure that you have a few to start with. The hospital pharmacy will be able to supply you if you think about that ahead of time, because your local pharmacy may have to order that medication and might not have it available for you right away, or they may be closed if it's a weekend. Home care and Home Health Central, we again talk about that in the guide. Home Health Central is a centralized intake for people who are at the hospital and have surgery. And that Home Health Central will help coordinate your community home services. There's usually a post-operative check. Sometimes it's made routinely and will be made for you, but often you have to schedule it. So find out if you need to make the schedule on your own and do that as soon as you can, because it's not always easy to get an appointment. That appointment may not need to be in person. So find out if it can be a telephone or virtual visit, or if that visit might in fact be able to be done by your local providers. Same for the follow-up appointment, which is usually made within 2 to 6 weeks. Do you need to call on your own, or will they make the arrangements for that appointment? And then who do you contact if you have concerns or questions? Can you reach the surgeon or the nurse practitioner, or do you need to talk with the primary care clinician? If you do, make sure that they know that you're coming home and that they will be the point person for you if you need care. Of course, there's always the emergency room if you have an urgent situation. Suture removal, however, can often happen in your community by your local nurse. So think about, again, the guide helps you think about all of those things so that you're not dragging yourself 4.5 hours back to Kelowna. If you live in the trail area or on to Vancouver, you may be able to get some of that support in your home community. Okay, next slide. So are there questions? Do we have anything in the chat, or are there people who want to write something into that Q&A section at the bottom of your screen?
Currently no questions in there right now. So yeah, we're open to any questions anybody has. Obviously, it's a fulsome amount of information. I thought that was great, Mindy. Thank you very much for running through it. Fantastic. And Kim will, I think it's in there already, but Kim could put it in again, the link to access the information, kbpac.ca/community. So that is all available there. And since we don't have questions, we can keep going if you want, Mindy.
Perfect. Let's move on, because I want to tell you about the forum, and also please stay on for a few minutes at the end, because we have a little poll that we'd like to ask you, just a few short questions. Okay, Paul, do you want to talk about the forum?
Yeah, absolutely. So this is a kind of we're testing this out. We're beta testing the idea of creating a community forum. This is a space where patients can connect with each other, residents, family members, people can connect with each other to share experience, to share information that they may have about the process with each other. It's not a medical site, as Mindy. It's not for medical advice or anything like that, as Mindy mentioned at the beginning of the presentation here, but it is a place where you can share information. And what we found in our initial survey was there was just a ton of information that patients had separately that they would say to us, oh, well, I shared this with so-and-so, and we just thought it would be fantastic to have a space where patients could connect. And this is a space that is on the KBPACC website. It's, again, you can access it through kbpac.ca/community. And it's very, very lightly moderated site. So do be patient with us, because we have to approve each of the comments and people as they sign up through the community forum. But once you're approved, you'll always get a message with whatever email that you sign up to the forum with. So you'll know when there's new messages for you, or when your message has been approved to go, or your post has been approved to go into the forum. Usually that'll be within about 24 hours, but this is something that we're testing out to basically enable the community to connect with each other around these pathways that we're developing. The first one being the surgical pathway that Mindy has taken everybody through today. Mindy, do you have anything to add to that?
I'd really too. Yeah, I do. I would really like to encourage people to use the forum, because it's a place where not only can you voice some of your concerns, but if you have discovered something along the way that is helpful, potentially helpful to other patients, this is a really good place to post, so that people who are looking for information or who are frustrated can gain information from your experience. So anyway, we encourage people to go and look and help each other.
Absolutely, and we'll be promoting it in various places, including Facebook, and obviously it's on the website.
Great.
So
Okay, let's go to our next slide. So I did want to let you know that our PACC committee is continuing on with our patient education efforts. So our plan for 2025-26 is we're in the process of creating a palliative care article. And this one is going to support the Living Well campaign that some of you may be aware of. We're going to also be involved in doing continuous updates. So our articles that are on the PACC website are not sort of static pieces of information, but as new information comes in, or we get information based on patient comments, we will update those articles so that they should be hot off the press anytime you access them. We're also hoping to create 3 or 4 new articles in addition to our palliative care article, and potentially working in concert with the divisions of family practice to meet some of their patient education needs. We'll be continuing to give presentations locally and attending local events to bring patient education and help to encourage people to take charge of their health and healthcare. We're at a time where resources are scarce, and so we need to be doing as much as we can to support the providers that we do have and the services that we have, and to help each other. Finally, we're going to be creating additional patient pathways, and we'd love it if you would reach out to join us in these efforts. And our PACC website, again, is put onto this slide.